10 minutes after 7 o'clock in Trinidad and Tobago as we continue with the second hour of Morning Edition. Let's remind you again, Lady Young Road closed once more in that area of the landslip yesterday afternoon. There's been some more rubble coming down, so it's been closed. The Minister of Works has indicated they hope to clear the area in 1 to 2 hours' time. In the interim, the priority bus route has been reopened to regular vehicular traffic from Morva Junction into Port of Spain. So just be mindful of that. And the police service have advised do not use St. Francois Valley Road or Maryland Hill because there are already reports of attempts to rob motorists who are stuck in traffic in that part of the area coming into Port of Spain. So just be mindful of that. Let's shift to health issues because many people have asking the question, what is going on with this virus or flu or influenza that we are experiencing now in Trinidad and Tobago, where it just doesn't seem to want to go away? Well, in parts of the UK, the United Kingdom, there's an outbreak of what they're referring to as a killer flu. You know, you all had to come with some headline, a killer flu. Thousands have lost their lives in the UK and the United States, with officials calling it the worst flu season since the swine flu outbreak of 2009. Well, locally, the Ministry of Health is advising persons to get vaccinated for the 2018 flu season. Well, we're joined now by the Minister of Health, Terrence Deyalsingh. Not doctor as yet, but we do have a doctor with us, Dr. Vishwanath Partapsingh, who is the Principal Medical Officer in the Ministry of Health. Good morning, gentlemen. Thanks very much for joining us. What can you advise us, Minister, in relation to getting vaccinated and the severity of the flus and the viruses that are going around at this time?
Thank you very much, Fazir, and thank you for the opportunity. The first thing that both of us, both Dr. Partapsingh and I, want to make clear is that there's a vast difference between the common cold, your typical runny nose, watery eyes, sneezing, which is self-limited and runs for 3 to 5 days, which we are not vaccinating against.
Right.
And the influenza virus is 2 different types of viruses. The common cold will not land you in hospital, will not kill you. The influenza virus, which we are vaccinated against, has sudden onset. You get high fever, your lungs become clogged up with fluids, you get pneumonia, and you can land up in hospital and you can die. That is what we are vaccinating against. In the United States and the UK, people are dying by the scores due to influenza because they are not being properly vaccinated. We in Trinidad and Tobago, since coming into office, we have moved this country from 6,000 doses of vaccines per year to roughly 70,000 doses. Luckily, we had no deaths last year. So far this year, for this flu season, we have had none. But let me tell you how the flu season runs. Our flu season runs from October of any year to the May of the following year. So this year's flu season would have started in October 2017 and will end around May 2018. We want to vaccinate another 60 to 70,000 persons against the influenza virus. To date, we have done about 25,000. We have had no deaths, reported deaths. But Dr. Partapsingh will go into details about the differences between the common cold and the influenza, which is deadly.
But before we even get to that,
sure.
Dr. Partapsingh, thanks very much for joining. I suppose, Doc, the first thing we should be advising is that if everybody were to say, as soon as this interview done, I'm going to run to my health center to get a vaccine, is that something you'd recommend, Doctor?
Yes, we recommend everyone gets the flu vaccine.
Are there specific vulnerable groups?
So it's good that you asked that question because when you look at the persons who are dying and the severe cases associated with the flu, with influenza, it is those who are at greater risk, the elderly, the very young, those who have chronic diseases like diabetes. And the reason why these groups tend to become more adversely affected, or the symptoms and the signs are worse in them than others, because their immune system, by nature of their age, or like in the young children, would not have been exposed before, so their degree of immunity or their ability of the immune system to respond will be less. Same likewise with the elderly, so they are the at-risk groups, the elderly, the young, and those with chronic diseases.
Let's talk about the symptoms.
And also the pregnant population.
Yeah.
Because in the first year of flu, which I had to manage as Minister of Health, in that year we had 8 people dying. Of that 8, you had 2 pregnant women. So the vulnerable groups we are going after are our pregnant women. We have roughly about 18,000 pregnancies per year. Pregnant women, the elderly with chronic diseases like diabetes, health, even adults who are on immunosuppressant drugs, like for asthma, arthritis, cancers,
Yeah.
young children between the ages of 6 months to 5 years, those are the vulnerable groups whose immune systems are compromised.
And let's just, sorry, you wanted to make another
So I
point,
wanted
Doctor?
to, the one thing that we did differently than we've been doing before is that increase in vaccine coverage. And we've been able to show, I mean, we have the evidence locally to support the value of vaccination. We have not had the deaths that we would have previously had with influenza.
So let's talk about making clear those symptoms, because some
Yeah.
people may say, well, look, I just need to get some bush tea,
Yeah,
or I
yeah,
just need to go in the back of the yard and get it
Yeah.
in my grandmother used to always break in half and boil and whatever. What should people be looking for to say, well, this is beyond just the normal
So
cold?
flu and common cold, they are both illnesses that affect the parts of the body, the system that helps us to breathe, our nose or throat or lungs. But they're both caused by viruses, but they're caused by different viruses. And that's why the influenza virus is the one that causes flu, influenza FLU.
Sure,
So it's really a shortened form of the word influenza.
I only realized that about 6 months ago. But go ahead.
So really and truly, when we talk about flu, we are talking influenza. We are not talking common cold.
Yeah.
And so the severity of symptoms with influenza flu are much more. So you find that the sudden onset of fever, as Minister was saying, the higher fever, the body aches, the body chills, the malaise, the weakness, the low loss of appetite, and all of that adds to why it is you find that these vulnerable populations are even more at risk when they have influenza. If you have a loss of appetite, you're not hydrating well, you're not eating well, your body is already immunocompromised, or your immune system is weakened, and the regular population, for those who are like on immunosuppressant therapy, or your diabetics, etc. So they are now even more so because of the impact of the flu virus, the symptoms on them, even more so. So really and truly, the symptoms are similar in the sense that you still get the same, you may get fever. Common cold does not necessarily have to have fever. Minister talked about they having a runny nose, stuffy nose. You find those some literature say that they are the more common symptoms that hint to the cold, the common cold. Whereas the higher fever, sudden onset, the more rapid progression, meaning that you're well 1 minute and then you suddenly become really bad. Cough, shortness of breath, those more severe symptoms are associated with influenza.
I wonder if we could blame the West Indies for any of this.
Because
suddenly see these scores, you lose to Afghanistan and then you get bowled down
We're not going down that
115,
route there
and
this morning.
you feel bad right away.
I am not Dave Cameron.
All right, well,
No,
we had your ministerial colleague talk about Dave Cameron yesterday, but so
the higher number of, or the reports of this being a killer flu season.
Yeah.
So, and one of the reasons for that is the virus type that is circulating predominantly the more common virus has been found to be in those who would have died, or those who would have been hospitalized in the US and the UK for influenza is very different from the previous years.
Yeah, because that was going to be my next
Yes.
question. Why? Is it just cyclical that every 10 years, every 15 years, something like this crops
the
up?
current predominant virus that is causing the outbreak is the H3N2. So fancy name, but this H3N2 has been around since the 1960s. We do not know, I can't explain, I don't think, there are many theories as to why this now, as opposed to what was the 2009, the H1N1, it's just been there all the time. And so the H3N2 has been found to be the more common virus now in this season, and that is why. And H3N2 by its nature is more aggressive.
And
So,
Minister,
just before I go on, part of the public education campaign, and I'm glad you have given us this opportunity for Zero, is that people feel that unlike other vaccines where you take it, you are immunized for life, like polio, whatever, the flu vaccine is only for 1 year. It is not lifetime immunity, because the virus, in an effort to protect itself and propagate itself, mutates or changes on a regular basis. So the flu vaccine, unlike MMR, unlike polio, is not lifelong immunity. It is just for 1 year. So this is a yearly vaccine program that we are launching. Every single year, you take your influenza vaccine.
right. Quite a few questions come to mind
Sure.
immediately. Because of what appears to be a pretty severe season, should there be any port of entry precautions?
No, there's
Difficult.
no need for
No need for it.
because from two perspectives. We have we are bounded by the international health regulations. They help guide the measures that we put in place at ports of entry. And so we try to maintain that standard across the world. The standard across the world has not been to implement any such measures at this point in time. That doesn't mean to say that we are not monitoring a situation and we are still within our rights to decide what we want to do. But that is not the measures that have been proposed both at the international level, from a scientific perspective, from a perspective of trade and continuity of business. That is not the perspective. The perspective is vaccination.
Okay.
That is the mechanism that has been shown by WHO to be effective.
Do we have enough supplies of the vaccine?
We have more than enough. So, as I said, on coming into office, I would have met a protocol which would normally have delivered 6,000 doses of vaccines per year. We ramped that up to 70,000, so we have more than enough. As a matter of fact, we are even advising young, healthy adults like yourself who are either not pregnant.
Well, I don't think I'm pregnant.
Well,
but go
I
ahead.
should hope not.
Yes.
I would be very disappointed.
Yes.
Well, amazed. If you're not pregnant, if you don't have diabetes, you're not on immunosuppressant drugs, even the healthy population, we were advising them to get vaccinated. And I'll tell you why. There's something called herd immunity, where you vaccinate enough of a herd, enough of a population, so that you prevent transmission of the virus. So we have more than enough vaccines. We brought in 70,000 doses of vaccines into the country, up from a normal 6,000. So we are advising all those at-risk populations, and let me repeat it. Pregnant women, the elderly with metabolic diseases like diabetes, those on immunosuppressant drugs, for instance, those taking steroids for asthma, arthritis, people on cancer therapy whose immune systems are depressed, and children between the ages of 6 months to 5 years. Go to your health centers, go onto the Ministry of Health's website. There are 33 health centers around the country we have designated as vaccination zones. Every Tuesday and Thursday, you present yourself there and you will get your vaccination free of charge, as opposed to going to a private practitioner and paying a few $100s for it. It is absolutely free.
One question that has come up immediately. If somebody already has the flu, or feels that they may have, does the vaccine serve any purpose at that point? Should they still go ahead and get vaccinated?
They wouldn't get the vaccine while they have high fever. There are certain symptoms or signs that you wouldn't want to give someone who has a vaccine. But yes, they should still get the vaccine after they would have recovered, because they are still, the vaccine provides protection against a certain number of viruses, or types of viruses. So we don't know what you would have had, that particular virus, what it would have been. So you need to get the vaccine.
So in other words, if you're ill right now, just wait until you feel better, and then once the temperature goes down, go ahead and get the vaccine.
But I would still say, and if you're ill and you fall within one of those vulnerable groups, it is wise to go to the health center to get the advice, because we don't know, you still don't know whether you can still benefit from the vaccine at the time. Because ill for you and ill for me might be very different.
Correct.
You know, the real contraindications are fever. You wouldn't want someone who has a high fever. So that decision is really one that the healthcare provider will make with the individual person.
Is this particular strain more contagious than previous ones?
I wouldn't say that it is more contagious. It is more aggressive.
More lethal.
Yes.
And time is going by so very quickly, Minister, but with the normal precautions, washing your hands at all times, not putting your hands to your mouth just all of a sudden, would those apply?
All of that will help. It will help. But again, the evidence shows that the best way to stop this influenza in its tracks is vaccination. All those precautions will help. Cover your hand and mouth while you're sneezing, wash your hands. They will help. But vaccination is the way to go to prevent the deaths.
And you were mentioning the health centers are open Tuesdays and Thursdays?
Yeah, we have dedicated Tuesdays and Thursdays at 33 health centers throughout the country to specifically deliver the influenza vaccines to the population. You just walk in there. You don't even need to have your immunization card. No. Just go. Just go.
Dr. Partapsingh, you wanted to add something to that whole question of the vaccination protocol?
No, I mean, just to reiterate the cycle that ministers speak about,
the
cycle from October to May. So the flu vaccine that you'll be getting now was one, if you get the flu vaccine between now and May, you would still need, I would advise, come come November, when the next flu season starts, you come and get the vaccine again because it's a different vaccine or it's for a different flu season.
And I suppose all of these vaccines would have a shelf life and
Yes,
so on. So
yeah.
does that mean that after this batch, based on the different strains, it would have to be upgraded? And what challenge does that place on the Ministry of Health, given our economic circumstances and the various challenges that we face financially, to ensure that we do keep up to speed with all of these latest
So we have not
requirements?
let economic challenges impact on our vaccination program. As I said, we took it from 6,000 to 70,000. That's a huge investment in money. The monies are there. What we need is the public buy-in, and may I also say, healthcare workers. One of the groups that we want to vaccinate is healthcare workers because they are in the setting where the population comes in. And I must say they have not been as welcoming to the vaccine as they ought to. And I keep...
Why is that? That might be surprising.
It's a lot of myths, it's a lot of whatever. But every time I speak to healthcare workers, I have to encourage them, get vaccinated.
Well, let me talk
Get
to our medical
vaccinated.
doctor.
I don't think that response is specific to them being healthcare workers. I think it's them being part of the wider society which is exposed to all these myths and the notions about what are the viruses and where they come from and what is severe, and you get the vaccine and you still get the flu. You may get the vaccine and you may still get the common cold.
Yes.
You may not get that particular virus that the vaccine provides protection against, or you may not get it as severe. You may not have the symptoms as severe as you would if you did not have the vaccine. So I don't think it's a healthcare worker that because they're healthcare workers they don't want to use it. It is just because I think a part of the society.
One person even told us they heard and they read on our website that if you take the vaccine, you'll start to walk backwards. These are the types of myths that we have to overcome. Yeah, I see your cameraman laughing.
Well, no, I was going to tell you.
This is the reality we
if you
face on
get
the
a
ground.
vaccine, you'll vote for the UNC.
So you want to get me in trouble this morning.
Well,
I like my job.
that is the intention, but
Yeah.
Indeed, it is something. I mean, we might be
Yeah.
making light
Yeah.
of it, but it's a
Yeah.
serious
It's a
situation.
serious thing,
And
yeah.
the bottom line is you are urging people
Yes.
to take advantage of these opportunities and forget all the myths and all of the
Correct.
speculation.
And if you, like we talked about social media and the
Yeah.
information, source of information is very, very important. Go to the reputable sources. U.S. Centers for Disease Control and Prevention, CDC.org. You go to WHO. You will find the sound evidence. That's the literature that the science believes in, the majority believes in. That is what has been shown to be the effective response time and time and time again. And so the value is there. And the value of vaccines as a whole, I mean, when you look at, Minister spoke about measles, polio, we managed to not have these diseases, and it's because of vaccination.
Indeed, yeah, I mean, we all remember polio's almost cancelling Carnival in
That's right,
1972,
right, yeah.
and I mean, we've eradicated it here in our part of the world, so it's good. And by the way, if you're looking for reliable sources, if you see our website that says reliablesources.com, rest assured, there's probably not a reliable source, because when you try to advertise who you claim to be, you're probably not in many respects. But anyway, that thing about if you take the vaccine, you will vote for either party, that was just a joke. You know, people are always sensitive about it, get worked up about nothing. But Minister, thanks for joining us.
You're welcome.
Good to have you here as well. And indeed, amidst all the little political ping-pong and old talk, the serious issue is the virus. The vaccines are available Tuesday and Thursdays at the health centers. They're available for you at no cost. So it's up to us to take advantage of the opportunities and move away from all of the skepticism and the conspiracy theories and so on. Again, we'll take a break. Coming up towards 7:28 in Trinidad and Tobago. Can there be a vaccine that could help the West Indies get some runs in Zimbabwe? Well, not a runny nose, to get some runs. We'll maybe find out that at another time. We'll be back right after the break.